Big Money Bound TV, RRT Posse YouTube. If you're new to the channel, please subscribe, like, and share my videos. Turn on post notifications as well. If you're returning, welcome back. I appreciate you. RRT Posse, we in here. Hey man, it is 2020. And what I'm tired of hearing is respiratory therapists complaining about respiratory therapy field. I don't like it because of this, because of that. I'm sick of hearing this. What we represent, man?
Big Money Bound.
Say, let it roll, man.
Big Money Bound.
The kids, man. We got the kids, man. All of this complaining and talking bad about the career field and doing this, hold on, you cannot do that around me. I'm RRT Posse. I'm all for respiratory therapy. You gotta relax. All the respiratory therapists, you know what? I'm sorry, see that? Not all the respiratory therapists. I'm hearing respiratory therapists complain about, oh, the job is just too stressful. It's too stressful. That's because you letting it get stressful. What's stressful about it? Oh, I have too many patients, too much work to do. So you letting that stress you out? You're human. You can only do what you can do. You can give me 95 patients. Cool, thank you, I appreciate that. If I can only do 20, that's all I'm gonna do is 20. A person told me a while ago, man, when I was a transporter, you only got one speed. You only got one speed, man. When we're busy, when I got 12 patients, I'm working just as efficiently and as fast as I would when I got 100 patients. So I can't do 12 and I'm relaxing. Then when I get 100, I can run around. No. I got one speed. And that's what I'm working at. Safe, proficient respiratory therapist. I'm not finna do this fast. I'm gonna be stressed out. Yeah, I'm gonna be stressed out. Hey man, what I told y'all a while ago, don't let the job steal your joy. It's stressful. They got your joy though. They got you. It shouldn't be able to stress you out. You're human. Too much work. It can't be too much work. You're making it too much work by trying to do all that stuff that they're giving you. When somebody give you an assignment and it's a heavy workload and it's kind of, oh man, try your best. They understand that this is a lot of stuff and you're human. You ain't no robot or nothing like that, you feel me? So man, stressful is only if you make it stressful. You gotta just don't let the stress get to you. Well, I'm on this floor, they calling me for a patient over there on this floor, I gotta walk way back over there. Hey, you need me where? Okay, cool. I'll be there as soon as I can. I'm over here on the 7th floor. You want me to come down to the 1st floor at the last building? I'll be there. You just gotta bear with me. Now you can't pick that phone up. You where? 1st floor, you need me there? Okay, I'm on the way. Click and then run down there. No. Hey, bro, hey, relax. So that's why it could be stressful. Now they complaining about, I'm hearing therapists complaining about the pay sucks. That's because you didn't watch how to maximize your income as a respiratory therapist. That's why your pay sucks. I gave you all the gems and all the jewels that had your pockets overflowing with Betty. You gotta use, anybody say respiratory pay sucks, take them to the how to maximize your income as a respiratory therapist. That'll clear all of that up. Your pay shouldn't suck. If you went to school to be a respiratory therapist, it was a stepping stone. It was a promotion. It was an improvement in money. It was more fed in your pocket. Now you don't been getting this money for a couple years. Now it sucks. Sound like you're ungrateful, dog. God watching, man. Better be thankful, man. Be thankful for what you got, hey, bro. Be thankful, man. You're getting paid. You're getting a decent income. Oh, it sucks. No, you know what? What pay sucks? You wanna know what pay sucks? I ain't gonna get into all that. I don't want to hurt nobody's feelings, man. It's people in prison right now getting paid 3 cents an hour. Now that sucks. I know you ain't no prisoner. Now that pay sucks, man. You way above the minimum wage, which is $7.25 in Florida. I don't know what it's like everywhere else, but $7.25 in Florida. The average respiratory therapist pay nationwide is $28.50. $7.25, $28, man. Gotta be thankful, though. Pay sucks. All right, bro. You know what? If it pay sucks, okay. Go back to school and do something about it. Don't complain about it. If I don't like something, I'm gonna change it. I'm not gonna sit there and complain, oh, it sucks, but I keep doing it. Oh, RRT Posse, I got it, man. Cause they get disrespectful. RRT Posse, I got it. Another thing they complaining about. I don't get respect. You don't get respect from who? Like who? It's all about perspective. I'm sure when you walk, let's say you walk past a homeless person. They don't respect you. They don't just come say, hey, how you doing? They don't show you respect. But since they homeless, you don't need respect from them now. Now, if it's a healthcare professional, I want respect from them. Man, you tripping, man. I don't get respect. What do you like? How? Now I understand people have been unprofessional. Okay, that's different. But I don't get respect. I gotta hear somebody gotta elaborate on that. Drop them comments. What do you think they mean when they say they don't get respect? Like, please drop them comments and I'll try to get back to those comments because, like, I don't get respect. That's kind of like a broad thing. Like, it's a very broad statement. I don't get respect. You can be talking about your coworkers, your supervisor, your husband, your wife. That could be, I don't know. That could be a lot of people say the whole thing, I don't get respect. I gotta elaborate a little deeper on that, man. Then they keep saying, the nurses / the doctors are mean to me. How old are you, man? We are grown adults. Somebody being mean to you, now you don't like respiratory therapy field because somebody was mean to you? Man, it's all about perspective, man. You gotta somebody being mean to you, they said something mean to you, you gotta realize that maybe that's just a mean and nasty person. That's not because you're a respiratory therapist, that's because they just mean and nasty. They can say that to the dietitian, housekeeping, nursing staff, security staff. These people are just nuts in the head. Nurses and doctors are mean. All the nurses and doctors are mean. They're just like certain people. Some people are nutcases. And if you say all of them are mean, now you making yourself a nutcase as well. Bro, we gotta knock it off, man. In 2020, we gotta knock it off. You can't be saying you don't like respiratory therapy, you don't like field respiratory therapy because nurses and doctors are mean. Nurses and doctors ain't mean to me. I don't have some nurses and doctors say some things that were wild, outlandish, just crazy stuff. I just looked at them and said, yeah, you know what? Dog head ain't right, man. Something right over there. They ain't mean. They need help. They sick. It's all about your perspective of how you look at this stuff, man. I'm being serious. As a respiratory therapist, I'm underappreciated. How? How are you underappreciated? When somebody can't breathe and it's a cold blue, they need intubation and ventilation, they run as soon as they see a respiratory therapist. Oh, thank you, yes. Oh man, super appreciated. What? When somebody can't breathe and they see a respiratory therapist, their appreciation is through the roof. So do you mean that hey man, share this video, because they need to clarify what I don't feel appreciated mean. I don't feel, well, I don't feel appreciated once I get the patient back to breathing and ventilating well, they don't care no more, they kick me out. Hey, your job is done. You're done. You want me to keep paying you on the back for 8 months? Like, come on, your job is done. You saved the patient life. Ambu, C&E, you had your C&E going on. You was ambuing, ventilating the patient. We brought him back. He on the vent. She on the vent. It's good. Job well done. That's it. You want to keep getting praised for 9 and 10 hours? Come on, man. This is a hospital. I don't feel appreciated, man. You know what, dog? 4 hours. You know what? It's 2020, Lord. Forgive me, it's 2020. Our Father who art in heaven, hallowed be thy name. Please, man, it's 2020, but these folks is getting me in. RRT Posse, I got us. Man, patients always asking, did you go to school for this? Did you go to school for this? Obviously, if they asking you, they don't know. You gotta take it from like a patient's point of view, a patient's standpoint. They just see you come into the room with a cart, give them the breathing treatment, put it inside the nebulizer, put it over their head, and go to type on the computer. They thinking to themselves, this isn't really hard. So hey, they ask you. They could just assume that you ain't go to school, but they could just assume. But by asking you, you could have, you could not have. Hey, did you go to school for this? Yes, I did. That's all. Did you go to school for this? I don't like when they do that, man. Did you go to school for this, man? I love when they ask me that. Yeah, I went to school 4 years. And it was hard, but I'm here now. I'm here now, dog. I almost ain't make it, but I'm here now. I love when they ask me that. Yes, I went to school, Palm Beach State College. RRT Posse, I got us. Big Money Bound TV. Man, I'm just, bro. Man, oh, man. Hey, this is the last one that I'm gonna leave it alone, man. Hospital/department drama is too much in healthcare, this and that. Hey, I don't care nothing about the drama and this and that, what's going on, man. I don't care nothing about that. Oh, they not my friends no more, this is my friend. Hey, when I went to school, did all that hard work and applied for this job, I didn't come here with the notion thinking, yeah, I'm gonna come in here and make friends. Nah, I came here saying, I'm gonna come in here and make ends. I'm finna get this fatty. So if somebody can get mad at me, get upset with me, hey, I ain't come here so you can be my friend. I came here so I can get to these riches, do my job, be a respiratory therapist. That's why I came here, man. So the drama could never affect me. Long as my badge work, beep, beep, I'm good. The drama makes you not like being a respiratory therapist? What? You know what, man, I'm mad, man. I'm mad. Big Money Bound TV, RRT Posse. I'm mad. Please like, subscribe, share my videos, turn on post notifications. I am angry.